Greetings, everyone. We've got Michael Talerico on the line with us today, and Michael is the Vice President of Delta Health, which is an InfoLogix company. And we are talking to Michael today about Delta Health and about some of the trends that he sees going on in the healthcare industry as far as staffing goes. So, hi, Michael. Welcome to today's podcast.
Hello. Thanks for having me.
So first, give us a little bit of background on Delta Health and what the company does and the types of organizations you serve.
Okay. Delta Health is a strategic cost management consulting firm. The company has been in business for over 30 years, and we have worked primarily with hospitals and healthcare systems to help improve their financial performance through productivity and efficiency gains. Delta is a company that works almost primarily with financially stable organizations because we like to work with healthcare systems that can implement productivity improvement and avoid staff layoffs. Delta has had tremendous success and has a very impressive list of references. We have had the opportunity to work with organizations such as Baylor Healthcare System in Dallas, Moses Cone Health System in Greensboro, Memorial Hermann Healthcare System in Houston, Texas. And the thing that is always, that we always feel proud of, is those organizations achieved and maintain a financial status of profitability, and at the same time also are superb and overachievers in the quality category. Just as an example, Baylor Healthcare System and Memorial Hermann Healthcare System have been recognized nationally for being, if not the best, one of the best quality-oriented facilities in the country.
So can you give us some insight into, those trends and similarities you're seeing kind of across the board? Sure.
Well, the healthcare industry is unique in the sense that it always is facing challenges about reducing costs because the way it recognizes or receives revenue, it seems that the payers are always looking at ways to reduce revenue. In this particular economy and environment, there is a severe burden on hospitals and healthcare systems to maintain financial profitability. One of the main causes of the challenge is there has been a significant reduction in elective procedures, procedures that usually drive pretty good profit margins for hospitals and healthcare systems. As those elective procedures began to shrink, there was a drop-off in patient volume and activity and a corresponding drop-off in revenue at the hospital and healthcare system. So as a result, you'll see a lot of press in the larger organizations such as University of California, San Francisco, that they are all implementing cost savings or cost cutting measures. And that is a challenge that Delta Health is very capable at addressing and really working and assisting hospitals and healthcare systems to do it in a way that they can avoid the layoff. Every hospital in America right now is looking at their cost structure and trying to determine the best way to reduce costs while maintaining patient quality or improving patient quality, but also maintaining, employee satisfaction and morale. Very difficult for an executive, a CEO of a hospital, to make difficult or hard decisions that impact the employee group. Anytime you're thinking about reducing your staff or laying people off, it has a very, negative impact on the community that you serve. Mm-hmm. So executives really look to layoffs as a last resort. If there's the opportunity for a hospital to improve their cost structure by being proactive and employing other techniques, CEOs will always investigate that. So just to come full circle, the economy has not created a new challenge in the healthcare industry. Managing costs has been a challenge always, but this recent environment, the difficulties that we've experienced, have had an impact in the healthcare industry, and that it has accelerated the need for hospitals to reduce costs.
So layoffs aren't necessarily the go-to solution when they want to cut costs. So what would be some of the common things that hospitals are doing right now as a way to cut costs?
Well, if you look at a hospital or healthcare system, the two major cost components are going to be supplies and salary or employee cost. Hospitals are always looking at their supply costs, and they're working with GPOs and other organizations to make sure that their contracts are favorable and that they can manage and reduce their supply costs. But that's something that takes up about 40% of the total cost. 60% of the total cost on average relies in the salary category. So hospitals, when they're looking at reducing salary, there's a couple different ways that you can achieve cost reduction. The best possible scenario is you can drive volume or activity to your organization and try and absorb that additional volume, which will also increase your revenue, while maintaining the number of full-time equivalents or your salary cost. The other option is to look at your attrition rate and try and allow attrition to occur naturally. So as FTEs and dollars leave the payroll, that enables a hospital to kind of decrease their salary cost naturally because they're not filling positions. And if it's happening at a rate that is corresponding or at least somewhat related to a drop-off or a decrease in volume activity, then they can continue to get their costs in line. Best possible scenario is career redirection. If you're working at a facility that is always looking to grow or to open new services for the community, and you've got openings or needs in other areas, try and move employees into areas where there is a need. In this environment, people are more willing than ever to look at job alternatives rather than looking at being reduced. The last, and then probably not the least, is reduction of overtime and agency hours, and specifically agency hours. Agency hours are extremely expensive inside of a hospital. So if you're looking at any kind of quick reduction, the first place a hospital should go is to agency and then finally overtime, because those are the high dollar hours. So as you look through your organization and you think about career redirection, moving someone from one department to another, if a department is reliant upon agency personnel, well, if you have a fit inside of your organization, it's best if you look to move a full-time employee into that position and reduce the reliance on agency. And the same thing goes for overtime. Mm-hmm. So any department that is seeing an increased use of overtime, let's look to put full-time equivalents in where appropriate, reduce the overtime. That'll reduce your cost, and at the same time, it will also improve the morale of the department, because overtime has a tendency to burn out personnel.
And the strategy that you just mentioned there, where it involves attrition, volume absorption, career redirection, reduced overtime and agency hours, and the sort of skill mix adjustment, that is a strategy that is known as strategic cost management, correct?
That is correct. Any hospital that can look at their current cost structure, specifically their salary structure, and strategically make decisions by looking at good information and evaluating each department from a productivity standpoint to determine how they're doing. Are they appropriately staffed? Are they overstaffed? Are they understaffed? What's the use of overtime? What does the service indicators look like? Are they achieving high quality? Then you can start to make strategic decisions and determine by department, by individual area, where are the departments where we can look at attrition or reduction of agency to improve our cost structure, and where are the departments that are staffed appropriately, meaning they've got good quality, they're not reliant on agency and overtime in order to get the job done. And then the last category is where are the departments that have excess capacity. The industry can't afford to have departments that are running at excess capacity, because that means they're unproductive or not fully productive, and it's going to increase your cost structure and have a negative impact on your bottom line.